second webinar. Good morning or afternoon to everybody who's joining us today, whether it's whatever part of Australia you come to us from or overseas. Welcome to our second webinar in our LARC series. I'd like to welcome you today to this webinar around co-design. I'd like to start by acknowledging that we meet today on different lands across Australia, and we acknowledge the traditional custodians of the land on which we meet, work and live, and recognise that this land always has been and always will be Aboriginal and Torres Strait Islander land. We recognise their continuing connection to the land, waters and culture, and pay our respects to their elders past, present and emerging. Once again, thank you for being here for this LARC series. For those of you who this might be your first webinar or might be new to the LARC program, I just invite you to, after this webinar, to have a look at the ARLF website and follow the links to the LARC program. You can read about the different elements of the program that we're carrying out along with our partners. I'd just like to acknowledge our partners as well, the Regional Australia Institute and the various leadership organisations from across Western Australia, South Australia, Victoria and Tasmania who are partnering with us. I'd like to introduce our guest today, Susan Allan. I'll read a little bit about Susan and then I'm sure she can add to that. Susan is passionate about the potential of development work to promote community harmony and strengthen social and economic inclusion. She's worked for over 25 years in a variety of direct practice and management roles across 4 regions of the world. She's worked with the Australian Government to lead the participatory development of rural and remote health programs in Queensland, as well as establishing the social inclusion team with Multicultural Development Australia to offer a suite of responses to refugees and asylum seekers across the greater Brisbane region. Susan is an experienced not-for-profit board member, having held various positions across housing, disability, social enterprise and community centre organisations. She was a manager for Social Cohesion with the Queensland Government, and she's currently the founder and director of Lift Enterprises, a community development agency that works in partnership to lift leadership, social impact, and not-for-profit performance. She's passionate about a community development approach and seeking impact that will lift the lives of the most vulnerable. Susan, thanks for being with us today.
Thanks very much, Andrew. It's a pleasure to be here with you all. And I'm in Brisbane on Yagara and Turrbal country.
Fantastic. And I believe our second speaker today has joined us by phone. I'll just double check. Sharon, are you there?
I am there. Can you hear me?
We can indeed. Thank you very much. I'll just introduce Sharon to the audience today. Professor Sharon Rundle-Thiel is a social marketer and behavioural scientist. She is the founding director of social marketing at Griffith, which is the largest university group of social marketers in the world. She is founding co-editor of the Journal of Social Marketing, one of the world's leading behavioural change journals. She has led projects that have changed behaviours for tens of thousands of people in areas including health, the environment, and for complex social issues. She's also led programs that have increased healthy eating, changed adolescent attitudes to alcohol drinking, reduced food waste, increased dogs' abilities to avoid koalas, and many more. She has published more than 200 books, book chapters, and journal papers. Awards and appointments include the Philip Kotler Social Marketing Distinguished Service Award and Australian New Zealand Marketing Academy Fellow. Acknowledge her innovative, high quality practice and science and her leadership. Sharon, thank you so much for joining us today.
Oh, thank you so much for having me. And everyone, I'm so sorry I'm not sitting there online. I had very tech issues. I'm over here in Perth attending an ANZMAC conference at the moment.
Not a problem, Sharon. We will adapt and we'll still enjoy your contribution, I'm sure. So I'll start with a question for Susan, and then I'll ask the same question to Sharon. Susan, how do you define co-design, and what are the elements that you look for?
So some deep thinking about this prior to this webinar to think about how I pull that together. But I think the most important thing for me in defining co-design is that it's the act of inviting people who are most impacted by an outcome, whether that be a service, a policy, a product, a program. So it's the act of inviting those people to have genuine influence over the inputs, processes, and decisions that shape that outcome. And coming from a community development approach and a practice approach to co-design, I think the elements that are really important to me that would distinguish something like co-design is that we would seek to involve people, as I said, who are most impacted. Recognising that people are the experts over their own lives, and we're honouring that lived experience by involving them in the design process. That we would resource the work, so that we recognise the need for resourced information flow, community time, secretariat, so that people are enabled to participate in the best ways possible. In developmental practice, we also talk about working at the pace of the people, but I think in a co-design process, given the number of stakeholders there, it's really about negotiating a realistic time for the work. So for something to be co-design, it can't be we have to have a decision in 2 weeks, really, unless there's been a long engagement process beforehand. We have to honour people's ability to actually be involved at their pace. That co-design has an element of balancing the input and influence of, experts, leaders and people. So it's not just driven or controlled by one of those groups. So the people who will be experiencing or the beneficiaries of the outcome, people who may be leaders in their community or leaders of the approach, people like yourselves who may be initiating this design approach, and experts who come with particular industry and practical knowledge. We need a balance of those inputs there. I guess the definition of co-design as well is that, there's an element of those of us who are initiating it of holding our agenda lightly. Now, it's different than other developmental work in the sense that we've already got a scoped project, something that we're trying to design together. But I think it's about being open to different ways of conceiving that and how it would be developed, and meaning that I guess it's genuine and authentic receptivity to other people's ideas and other ways of knowing and doing. So honest communication processes, transparent processes. And, there was a definition I looked at that really talked about design solutions being grounded in both community need and government constraint. And I think acknowledging government constraint, if government is a key stakeholder, is really important, and that's where the transparent communication comes in. It's not that we can just go off and design something with no boundaries and no limits. There are always those limits, but it's actually being honest about what they are, and that we're not inviting people to shape something where they actually, at the end of the day, won't have influence over that particular impact.
Thank you so much. Sharon, the same question for you. What would you like to add to that, or perhaps other thoughts? How do you define co-design, and what elements do you look for?
Thank you. Look, co-design is one participatory design method and tool. And for those that don't know me, I'm a marketer by background. So we were always trained to place people at the heart of everything we want to do. So commercially, that would mean consumers, and you go looking for the gaps and the things that need to be overcome to move forward. Moving into the social change space, that then, as Susan sort of pointed out, there's a lot of constraints and institutions and layers and structures that have been built. And challenging that now is part of what true co-design needs to sort of take head on. Co-design is very misunderstood as a term, and I think we need to spend more time making sure we know more about the other participatory design methods. And I'm very happy to sort of send some resources through so that members in the webinar today are very welcome to access some of the stuff that we've been working across as we spend more time from the science angle, just sometimes breaking down co-design, comparing it to design thinking, which is a process that brings experts and all stakeholders into one process and steps them through that together. And we have other methods that we use, like creating collective solutions, which is get divergent viewpoints together, then take people through a consensus process, and then we put co-design on the back end of that and say, now that we all agree on the key things we need to work on, how are we going to start to move forward, noting structural constraints. And in co-design, as you run it, you can actually give people monopoly money, have them investing so that within the budget envelope, they can start to determine what's possible now, maybe next, and you can start to get more pragmatic about what you can actually do. So to answer the question from our standpoint, when I'm training for co-design, I will show you 7 steps. Those steps allow people to design a thing for them and other people like them. So it could be used commercially, and I could be doing products and services. But in my space, when I'm doing social marketing, like the behaviour change work we do, it's typically in response to a challenge or a problem. So most recently, some of our largest work, we did co-design to prevent youth sexual violence and abuse. And that was all aimed at moving government towards an action plan for 2 places in Queensland. We've used it on teenagers, like 15 to 16, for vaping. And in this 7-step process, and if you Google co-design and social marketing at Griffiths, you should be able to pick up a little bit and start to see what those steps are. But basically what we do is spend time planning and resourcing. So we have to bring people into a room together who've possibly never thought about the problem that we're dealing with, whether it's how we stop vaping or preventing violence. And you show them a few different ideas, like here's some really effective programs from around the planet that might have worked elsewhere. And what that does is it just warms them up to the idea, because like this is something they may never have thought about. And then you take them further forward and say, with a blank sheet of paper, so if you're running it in person in a room, it's just imagine a piece of butcher's paper, a whole heap of make tools. You actually give them the challenge of like, design it for me. What does this look like for you and other people like you? And we usually do that with little groups of 3 and 4. And then at the end of the session, in our final steps, we ask them to pitch. So tell us in 2 minutes what that idea on paper is. And then sometimes when we've run co-design processes, we've even asked other members who are now sitting there listening to that team's idea to basically vote, like from 0 to 100, you know, how likely would it be that they would participate in that? So they're ways that we can actually step the people at the heart of the problem right through a design solution. It's fast, it's effective. And in contrast to something like design thinking, where we've pulled everybody in right through a whole process, it's a bit cheaper too. So that's the nice thing about this co-design process that we have used. And I teach it today when I'm training because it works. Like when I've put it in to build programs that, you know, I'm sponsored to go out and deliver, it's changing hearts and minds, and it's doing something fast and efficiently. So that's how we have come to see co-design, one tool in a participatory design mix. And again, like I said, reach out, happy to share resources and help clear up some of the confusion, because we see a lot of terms used and people write about co-design, but when I look at it, I think it looks a bit more like a focus group, or it's still very much led by our agendas. And what we want to do is stop that. These are their ideas, and they're all great ideas, but then work through stakeholders to go, what is possible now? Because again, getting back to those structures, layers and institutions, we have to be able to challenge how else we can start undoing some of what's not working.
Yeah. Sharon, we'll just stick with you just for a moment, because I think the second question I have for you sort of leads into what we're just talking about. But we have an audience today that are across many different sectors, and I've become aware sometimes we're not aware of the terms that we use in our own sectors aren't widely known across. So for the benefit of those who in our audience who may not know, what is social marketing? And yeah, if you were to talk to someone who's new to it.
It's a really good question, because I think social marketing, unfortunately, has about the same level of confusion attached to it as co-design does. I started social marketing at Griffiths formally in about 2013, and I think it took me 5 years for my senior management team at the university to understand that social marketing wasn't Facebook. And certainly my commercial marketing practice, like a lot of people see marketing as communications. But marketing is actually a very strategic process, and it's about getting into people's hearts and minds, figuring out what that solution looks like and making it happen. And our team have produced the CBE process just to explain the strategy of a marketer and how they apply strategically to keep people at the heart of everything they do. So if I'm running my behaviour change campaigns, I'm monitoring and watching for how many people are looking. Importantly, how many people are then reacting and doing something as a result of what we're doing. So that's the strategy that a marketer brings to the table. And to just give you a definition, social marketing is application of marketing to deliver either health, environment, or social change. So we're heavily outcomes focused, and that's drawing from our commercial marketing roots. Like we're here to I'll use the word sell something, but that might be an idea, a behaviour, a change in practice, a change in layers and structures and institutions. But essentially, it's designed to create a win-win outcome for all parties. So that's where some of that sort of, I referred to other processes that we use. It's about trying to work together to start to get the change we actually need to see happen.
Yeah, cool. Thank you very much. Susan, just back to yourself. Having worked across 3 tiers of government, you've worked in academia, in service delivery, and training. So you've sort of got a vast experience across multiple sectors. Where have you seen co-design or perhaps some other kind of participatory design done well?
There's lots of examples from, working with small community groups who may have established, a partnership with Queensland Racing to have a community garden at the track, through to Australian Government. But I think I'll share an example that was led by the Australian Government Department of Health and Ageing in the early 2000s, and it was about focusing on rural and remote health. And the challenge, as Sharon said, or the problem at the heart of that, was that both Commonwealth and state have responsibilities for different levels of health delivery, acute and chronic, primary and tertiary healthcare. But there were a number of communities, particularly those in rural and remote areas, that were falling through the gaps of those. That, Queensland Health wasn't able to respond to some of the issues, nor were the general practice programs and other health promotion programs they were having. So they developed this program that had quite a few $1 million in it, tens of millions, to be able to respond to these issues. But the approach was quite different. So rather than putting out, a funding program where communities, or an organisation put in something, what they did was that they'd really acknowledged there was a need for a different approach to be able to work outside of some of the current constraints that particularly state and Australian Government had in terms of health delivery there. And what they did was that they invested in pre-planning and the design stage of the work. Now, that was something really unusual at that time. You didn't get any funding to put together your model of service delivery or your approach. And so recognising the challenges of geography. So there were a number of projects through Queensland, one of them in the Burdekin, and I know some of your leaders are from that area. Another that looked at the challenges of the Gulf country, and Mornington and Dormagee, Normanton, Mount Isa, in those particular communities. And so what they did was they provided funds for community members to come together with experts, consultants that understood rural health delivery and what some of the issues were around the chronic disease issues, local government, other areas, and actually to design the health service that would best meet their needs. So, for example, in the Gulf country, there was a need for allied health services. There were some major workforce issues in terms of recruiting and retaining people into that area. And of course, there were challenges of, the fly-in, fly-out models and what that meant for relationships in community, particularly working with First Nations communities, developing trust with them, how much you were on the ground, whether there was processes to support people to kind of be an apprentice to that work and gradually be trained and take on that work so that they would have, local people in formal positions at a later time. So I think the elements were there, that really willingness to acknowledge a shared analysis first up, and Sharon talked about this too, when they get people in a room, how do we understand what's happening here? We need to look at it from many different angles. And, not just have the perspective of health professionals, but have the perspective of local people around why people do or don't engage in those processes, what's going on for them, what the barriers are, the preconceptions they might have around this health. So they leveraged the existing trust and connections that community leaders and others had. They worked with existing structures that were in the community. So it could be the Aboriginal Land Council, it could be an existing community health association, it could be the PCYC, so rural women's associations, they leveraged those, invited them to come in and have a say, and together they shaped a particular model, but they had resourced it so that, the consultant, for want of a better term, was able to put that together and then, share it back for people to comment on and shape in that space. So there was multiple listening, checking, rechecking kind of testing phases. And I think the thing that was really important there too was providing resourcing for travel so that these conversations could be had face to face. But it was also having a time frame that was realistic for this work to be undertaken. We need to make space for communities. Sometimes not every meeting we set up happens. There can be sorry business, there can be cyclones, there can be a lot of things, and we're looking at remote practice as well. So that was really important. I think the other thing that was really important was being honest about the limitations. So they had committed the funds in advance. So if you go through this process, there's this bucket of money waiting here. You design the thing, and then we, basically, it wasn't rubber stamp approve it, but it was, pretty much guaranteed if it met certain criteria. But we had to be honest about what the limitations were in terms of not getting a Pollyanna project. That could we actually attract workforce there? Would there be housing for them to live in? How would people respond culturally to the types of issues? So, being really clear about that was important. And I think in terms of, this community practice that where the result is a shared designed model, including the choice of who would be the governance entity for that, is that there's the implementation phase also retains some flexibility there. Understanding that, we've devised this thing, but once we go to put it on the ground, it will also need some tweaking and responsive practice. And particularly in rural and remote areas, there can be underspends, things that you want to build don't get built in the time that they need to, things happen, cyclones again, floods, those kinds of things. So also, I think if government is leading a co-design practice or initiating and inviting people in, thinking about what happens beyond the design phase of that as well is important. And that's what worked really well there. And, it wasn't that those services that were developed in response to that process were all, flawlessly implemented and had no challenges. But there was some lovely partnership then between Commonwealth Government, that program, and the communities in terms of their flexibility to respond later to things that happened. So yeah, I still see that, nearly 20 years on as a great example of a government agency being prepared to do something a bit differently.
Yeah, fantastic. Just in light of that account that you gave, I'm going to flick to one of our questions that's come in from one of our audience members. And for those who are watching, if you would like to submit a question, by all means, there's the Q&A tab down the bottom. But thank you, Richard. He's asked this question, and I'll invite you, Susan, to talk to it, and Sharon, if you wish. What do you do about engaging culture, language, neurodivergent and power issues, gender, small communities, and who is represented? So I suppose that's sort of a question around, acknowledging power, positions of power in that kind of consultation, but also, I suppose, having that wide array of voices at the table.
Yeah. Look, it might come back to what Sharon was saying too about, there are a lot of participatory methods, and, co-design could be viewed as one of them. And I think, where an entity is going down a process of consultation, those kinds of issues that Richard raised, I think are trickier. But if it's a co-design process, I think one of the elements that would be there for me from a community perspective would be that it is initiated by those with an interest in the improvement, but it's often co-initiated by those who are experiencing the issue. So a number of the groups and some of those more vulnerable cohorts that might be affected by this issue may be undertaking advocacy or raising a voice saying, look, you're getting this wrong, or there's a particular issue here that's not being addressed, or something's not working for us. And thereby, can we have a voice in this process? And certainly in the social services, those kinds of things happen. We have an excellent example in Queensland at the moment where there's been a significant increase in rates of homelessness for women over 55. And a number of women who had experienced that issue, or are experiencing, or at risk of homelessness, came together, formed their own network about that, and then started to engage government about, yes, we've got this housing crisis with rents and the floods here and a range of other things, but we've also got these unique issues for this particular target group. And, you know, you've got a housing strategy here, Queensland Government, and can we come in and begin to help you shape a response that particularly works for this group? And so those community members who have experienced the issue, Richard, they're the ones that also help to bring in other participants into that space as well. So that's one way that things can happen. The other way is, of course, that you can use connections with existing groups that you have in community where, you know, people who are affected by this issue may be represented, and go through their leadership and invite their participation into that conversation as well.
Sharon, from your perspective, which you know, around bringing the various voices at the table, and there might be different levels of perceived power, what would your response be?
Oh, look, I could probably use an example of the violence prevention project in that there were specific areas of community where need was higher. People from multi-diverse backgrounds, so we're talking culturally, linguistically, Aboriginal, Torres Strait Islander. There were young mums, so teenage pregnant mums. And so cohorts like that were actually identified at the start of the project. To cope with the multilingual component, we actually had a youth advisory committee. We trained them to be co-designers, and some of the young people in our community actually ran the co-design in their own languages. We worked with culturally appropriate people because I'm not Aboriginal Torres Strait Islander background, and so yarning circles were organised, and that work coincided with the work our team were actually doing. So there are ways to actually think from the start of the project, but at the same time then engage, as I said earlier, the people who don't normally think about this, because I think one of the challenges we have if we want to change the structures and what we're currently doing is to not only be listening to the voices who are currently advocating, but to make sure we're actually basically trying to get coverage right across other aspects of community who may not still even view this as a problem, because some of that is creating the bias, the ongoing sort of support for business as usual, and it's sometimes actually one of the biggest sort of barriers to change. So it is something that needs to happen. To address the power imbalance, I wanted to pick that point up because it's such a big one and it's something we have to navigate a lot. What we do sometimes is we actually bring some of the power agents into the co-design process, and we make them be note takers in those small group discussions where the 3 and 4 people who are at the heart of the problem are talking about what they want to see. And I have found that that is an approach that helps them to, it basically challenges their own bias and their own views, and helps to then have the conversations about, well, what can we unlock or change that might now build the extra support needed to stop talking about this problem and start actually delivering the solutions and the structures needed to prevent and support and give people what they're actually calling for.
Thanks, Sharon. The facilitator in me has already taken a couple of notes, Sharon, from a couple of things you said. I realised I've got to go out and get Monopoly money to add to my facilitator kit, and getting certain people to be note takers of other conversations. That's another tool. So thank you for that. Sharon, I'll stick with you for a moment because this is co-design and other participatory design practices are obviously taught in multiple disciplines, obviously with some differences. And obviously you've observed, so I'd just like your thoughts on how do you see the transition from theory to practice in the world, and what are some of the blocks that those kind of participatory design processes might have to them in the world when it moves from theory and classroom to practice?
Look, because I spend most of my time out there in the real world, but I do actually serve as a professor at university too. So I spend my 2 days a week sort of building what we know and then obviously teaching it. We actually, a couple of years ago, tested a process called abductive co-design. So taking what we know theoretically and what we believe is the way to go forward, making sure the ideas cards covered all of that perspective, but then are still allowing people in the co-design world. So as we moved out into the real world and said, what do you actually need to see happen? Again, giving them the freedom to discard any idea that doesn't work for them. Because I think from my standpoint, there's a lot of researcher or expert bias, and people tend to stick with what they actually know. Oh, we do that because they do that. Or so-and-so did it over here and it really worked. And it's very difficult to unlock people away from what they currently know, because people are really fearful and scared of the unknown. And it's incumbent on us, if we're actually delivering true changes, like the support and the structure people are actually calling for, that we're going to be doing something different. And we have to lean into that and be able to be comfortable with trialling that, which I still understand is a very big ask when there's budgets and people need to be proving that it's working. So it is a challenge, and it's, I think, incumbent on all of us to understand that if we're not overcoming divides, and we are experiencing things like women who are aged over 55 who are experiencing increasing rates, so listen to that word, increasing rates, then what aren't we doing already that's helping to reverse that trend quickly? Because we want to move that needle and shift the dial, and maybe community is telling us we're missing the mark, and then theory needs to start to change so that we can teach what's new and needed to happen to help drive action faster as we move forward.
No, thank you, Sharon. Susan, I'll just open that up for you to respond to as well. That, you know, what are some of the blockages that you might have observed?
I think one of the blockages to any, I guess, effective and sustainable collective decision making and action is not putting enough time in at the start for analysis and shared meaning making, that we jump to solutions too quickly. So I think in terms of, and this also speaks to the issue that you raised around power and people of different voices having a contribution there, that we really need to start with deep listening and set aside time in our process to really grow that understanding of the issue. And as Sharon said, you know, we need to look at it from every aspect, from people who might think it doesn't affect them and doesn't care about it, right through to those who are at the heart of it. You know, pick it up, look at it from every angle, know it as best you can, and understand how, I guess intentionally understand how culture, values, geography will shape the user experience in that space, because we don't know what we don't know. And you know, there are so many different groups and experiences of things that, you know, we really need to involve people and then to share that analysis and test it and retest it before we start looking at solutions.
Yeah, fantastic. I'm going to turn to some of our questions that have come in from the audience. So thank you, Maggie. She's asked, what are your thoughts around the collective impact approach, which usually has a co-design process embedded? What are the requirements for a successful collective impact approach where co-design has been included? Susan, if you wanted to give your offering to that, and then we'll go to Sharon.
Thanks, Maggie. And I'm aware that across Australia, the experience of collective impact, the Stronger Places, Stronger People program has been very different depending on the places that it is rolled out in. But from, I guess, a community perspective, I think there's been some strengths in the collective impact process through it having, I guess, an academic framework in a way. It's got a very clear, structured methodology that the Commonwealth and state governments that are leading that with community, you know, and consultants support communities to go through in that space. But I think one of the challenges is really having a look at when things maybe don't go to plan in that academic framework, how that works in practice. So, for example, if you know, people aren't, if it takes longer to bring people together in a community and to get different voices at the table, it might take longer for people to start to identify a shared issue or concern that's at the heart of what they want to address in collective impact, that we need to be respectful of giving them more time in that space. We might need to be respectful of people having some of these discussions in different groups where they feel safer to be open and honest, and then gradually sharing those back to one collective group. You know, one of the challenges I think for collective impact is it hasn't always been able to grant that flexibility, that you know, particularly know from being in government that, you know, we had certain timeframes that we needed to meet, you know, funding's over a certain amount of years. So that's just where some of the tensions are, and I think with good practice you can negotiate those. But the co-design element of people being invited in, the limitations or constraints being, you know, on the table, you know, right from the start, I think is really, really important. and that the outcome of collective impact won't look the same for every community. They won't necessarily go through the steps in the same order. So balancing that, the benefit of the framework that comes with collective impact work with the flexibility to, adapt it if it's required is really, really important for that work to be successful.
Thanks, Susan. Sharon, did you want to add your reflections or response to Maggie's question?
I think Susan did an absolutely fabulous job, and I think flexibility, I'm just going to absolutely endorse and back that, has to become the key. If we stick to being too prescriptive and just following whatever the process is, that's where a lot of things actually can come undone. And I think with impact, I think, again, that term, we're going to be very clear about what it is that we're actually chasing. We then ideally need to work backwards, so there's outcomes and outputs, and get very real, very fast about where are we going and monitoring progress. So the only other thing I would add is that dashboarding and making data easy to follow and transparent can become a really great way, if you've got a longer term project running, of making sure that it's real and that you can continue to challenge where are we getting to and are we getting there fast enough? Because as you're working across that community, who else aren't you talking to? You need to talk to and bring into a conversation to shift that needle faster.
Right, thank you. Just go to our next question, which is from Jane. If you bring in people who don't see the problem or they don't recognise it as a problem, how do you then manage the effort, the time in getting or not getting consensus that this is an issue that needs to be addressed? Sharon, we'll go with you.
All right, happy to tackle that one. Look, from my standpoint, there are many things that people go about their daily lives. They're thinking about food, getting to work, getting the kids to school, if they've got kids, etc. Like it's that we go into pretty much habitual patterns. And when I was talking before about the people who might not normally have thought about this, I mean, there are some people in community who've never experienced violence. They don't show any of the risk factors, yet they exhibit biases and things that are actually continuing to perpetuate problems. So again, it comes back to that first stage in the 7-step process where you show them different ideas and get them thinking, and it's amazing still what comes. And to give you a really specific case, and this one's a little bit quite specific, it was dogs attack koalas. They can actually kill them. And I had a heap of dog owners in co-design who have never experienced a koala attack, but we also, at the same vein, as we were working with that first ever 42, had 2 that had dogs that had attacked and killed a koala. So you're working with 40 who've never thought about this, never experienced it, 2 who have. And they go into their small breakout groups, design the program that would work for them and other people like them, and you walk away and make that happen. So we actually devised a program following what we were told to do, that basically the co-design process had said, make it fun, make it dog focused, not wildlife or koala, which was a trap that everyone had fallen into over time, and show me what to do. So we built a dog training program because they can be trained to avoid koalas, and we promote it with a festival, Dog Fest. So this is how you can get a lot of people who've never considered the issue at hand and still work with them proactively to say, what can we actually do to stop this from occurring? We've had a 40% reduction in hospitalisation from dog attacks in that region.
Wow. Thank you very much. Wow. Susan, did you want to add to what Sharon's shared? Your thoughts?
That's fantastic. I was hoping I'd hear about that project, Sharon. It sounds amazing. The thing I want to say about participation, because a lot of students that we're teaching in community practice and others ask this question, how do you get people involved, is, think about our own motivators. And as Sharon was saying, if dog owners and dog lovers, think about it from the perspective of them and the dog, if you want to get them in the door. And it's the same with a lot of community work. If you're framing something, would you turn up? Can you think about what the motivator or vested interest is for the people that you're trying to engage, and, kind of work, start where they're at, essentially, is what we do, understand their perspective and, begin to broaden that with others. Where there's a particular crucial issue that you want to make a difference on, obviously the people that are experiencing that or passionate about that will be the easy people to get in the door to start with. And they may then also be able to leverage, other perspectives and other groups for you. But yeah, just be really conscious about, we all have self-interest in why we participate and why we engage and why we follow through on things. And that's where, the work that Sharon's team does is understanding, I guess, human behaviour and what makes us change our behaviours is really important in that space as well.
I'll go to a question from Mohammed in Indonesia, and this probably will be specifically for Sharon. Is co-design the same thing as co-creation in marketing? And is the outcome, is it a value or behaviour? And how can it transform to volunteer or voluntary action?
That's a really great question. Co-design is one part of the co-creation process. Susan before talked about getting in and really having that deep understanding. And our co-creation work, when we do it, is very much focused on, we might be using a range of methodologies at that point, observations, looking at what people do, surveys, do they think and feel. We might be looking at the evidence base. What have other people done? What's worked before? Or what other products, services and voluntary programs are out there that have worked really successfully and well? So all of that deep learning then usually informs that co-design with those ideas that you take forward. So we at the moment are working to understand how we can improve citizen science programs, which is pretty close to your volunteer context. And so we've used both deep surveys. We had 2,000 people who talked about whether they do or don't volunteer for citizen science, why not, what's their experience. And we've been co-designing with them. So what is it that they would like to see and feel? And we actually went out and did a couple of literally citizen science things ourselves, like a koala watch program to see how others do it. So that's co-creation, because now we know what the program needs to look like and we're left with key insights starting to go, okay, we can see many of the challenges, and from next year we'll be starting to pilot pretty much a program. So I can't sit there with the 1, 2, 3 that we're doing quite yet, because we now need to we're still in co-creation. We need to bring all of that together and go, what's the core strategy that's going to underpin this thing that we're going to test? Can we get more people to participate in a koala watch program?
Susan, I mean, did you have thoughts around the transforming to volunteer action? I know you've worked in that space as well.
Sorry, Andrew, can you just rephrase that?
So Eco's question was, is co-design the same thing as co-creation in marketing? Is outcomes, values or behaviour? But how can it transform to voluntary action or volunteer action, I think is his question.
Oh, okay, yeah. I don't have much to add to what Sharon says in terms of, I guess, our processes in community development. They're more, integrated in terms of that co-creation, co-design process in there. I think the transferring to volunteers again is about understanding people's motivations, working with the shared agenda. And, that's so crucial in collective practice that, there can be many agendas on the table that people have interest in and could be passionate about, but it's about finding the starting point where they have the energy and where they're going to be able to connect in and make a contribution in that space. And so, that's where holding our own agenda lightly is important, Mohammed, because it's, we can go to a community group thinking that there's a particular thing that they've spoken to us about that we know is important, that we want to take action on. But at that particular time and place, something else may have come up and that needs to be dealt with first. And so, often, in the engagement phase of people, it's really about understanding what their key motivators are and if that's the right time and place for them to engage.
Great, thank you both. We have another question from Shane. He's asked of the relationship of moving from co-creation, co-design to co-innovation. Sharon, would you like to comment on that?
If that was directed to me, I would actually be using the words design thinking, in that the people go right through the process together, develop, test, iterate. And so in other words, just keep perfecting, improving prototypes, taking the prototypes into a full pretty much rollout phase. So that's the design tool I would be turning to. And to get the distinction between co-design and co-create, I think reading our CBE process, and there's a couple of papers I could point people to, vis-a-vis co-design, it stops people trying to conflate all of that into one thing, because we can show you sequence and a nice sort of process and path to actually follow. I hope that answers the question.
No, thank you very much, and we'll be happy to distribute, whatever resources you're able to provide to the participants' emails. Susan, did you have anything you wanted to add on to? No, that's fine. I've just got a question that I'd love the both of you to give some thought to and provide your thoughts for leaders, because the LARC program is around developing leadership behaviours and practices. For leaders who want to work with others using authentic co-design or participatory design principles and behaviours, what would be your reflections or thoughts? Susan, you got the floor.
Okay, I guess role of the leader is really about, in starting off, is really about leading the analysis and making sure that happens. So as we kind of mentioned before, it's really important to bring people together and to have space for dialogue, space for discussion, understanding each other's perspective, looking at things from different angles, use your who, what, why, when, where, how tools if you need to, or your strengths and weaknesses, and just basic things that really get people to understand stuff from each other's perspective. Another role of leaders is to be really intentional about inclusion. Asking, and Sharon mentioned this too before, who's at the table, who's not at the table, and why aren't they there? And, what do we need to do to make this process more accessible for people? And in community, that can be really simple things. It could be about the time of day. It could be about transport. There's lots of different ways. Could be about childcare. Could be about, having interpreters available to support people. It could be about giving them spaces to speak in their own cohorts and communities where they're more comfortable, and then someone feeding that back in. So be really intentional about inclusion and create space for that. And honour people's previous experience, because one of the things we haven't mentioned yet is that co-design, community consultation, community development, community work, strategic plan, there's been so many names of the ways that, or approaches that we have used over decades around basically inviting community members, particularly to give voice to something that government's interested in. And people have had really different experiences of that process. Sometimes they've been consulted on things and they've never heard back. They've had research done to them, they've never heard back. So we need to be really honouring of what people's previous experiences have been of being part of a group or collective process as well. Some people's only experiences of group processes may be school, and that mightn't have been a positive experience for them. So that's that stuff about starting where they're at and working at their pace as well. I think, inviting participation and being flexible about the terms of that is really important. Also, as a leader, you have a role in clarifying the different roles of the group members. So, if you're in a workshop, as Sharon's been talking about, it's a bit clearer. But if you're in, a less formal process of engaging together and coming through to an agreed outcome, then being really clear about, who's sharing information with people that aren't there, who's taking notes for that, who's going to follow up and check to, invite people or herd them when they haven't participated is really important. And also when there's gaps in knowledge and who we might want to invite in to explain an aspect of something to us that we weren't quite understanding, also really important. As a leader, I think it's also crucial that you ensure people know what the boundaries and limitations of their decision-making authority is. So being really clear about the authority, who gets to decide what, kind of know your limits of the influence that you have. Don't invite people to, decide or shape something where they're not actually going to have influence over that particular thing. I think that's really important. And in terms of going forward, think about what structures you may need to hold and sustain that work. So if we've designed something, and it could be a service or a process or a network or something like that, what do we need to hold that going forward? And do some of the people who've been involved in that design process, are they the ones that will be championing this into the future as well? Who's going to oversee implementation? Just being really clear about how this work, gets to that next phase, no matter, what we're calling that.
Yeah. Susan, before I turn to Sharon's response around leadership, just a phrase that you used around who's at the table. You know, we do hear it a lot, who's at the table, who's not at the table, who decided who sits at the table. I was just wondering whether you've had, you know, in your experiences, a situation where there was some co-design or consultation where there was quite a glaring obvious of a group who wasn't at the table, and you were almost surprised by the reason why and what you did to bring them, because we often hear about who's not at the table, but talking to participants and others struggling to bring people to the table if they've not been sitting at it for quite some time.
Oh.
I can give you a few minutes to think about it if you want. If you'd like Sharon to speak first. I put you on the spot.
Look, it's okay. I think a lot of the excuses that are given, and I think, you know, probably a bit more historically too, about why different groups aren't at the table, is about the resourcing and time constraints to get them there. So we don't have time to involve, you know, these particular groups. You know, particularly government, it's easier for us when we're in government to work with representative groups, you know, whether it's, you know, a land council or a, you know, network or a advocacy group for people with disability. You know, we can go to them and say, what's your view? Talk to one person and, you know, we've consulted. There are many groups that don't have representative structures like that, and deliberately don't have, because, you know, no one First Nations person can speak on behalf of everyone, no one person with a disability. And so having time for particular cohorts to go back to their communities to do their consultation and to bring that back to the centralised place, if we've got a smaller group, is really, really important. And often those timeframes, you know, there's not a tolerance for them in a policy environment, I guess, or a policy context. So that can be one of the reasons. The other one is cost. You know, particularly in Australia, we have such huge difference, you know, distances between things. Look, we have got much better doing things this way. So with Zoom and webinars and other things, it's probably a little bit less of an issue, but that technology is not always available to people either. But previously, the cost of getting people around the table, where I think, at least at the start of a process, you do need to have some face-to-face, some time to really build trust and relationship in these processes. And sometimes it can be people's prior experience that, well, we've tried that before, that group's difficult. You know, they're difficult to work with. You know, they're not as educated as us. They might not understand these concepts. They're not used to being in these formalised processes. And that's where the capability building work often needs to happen with different communities and groups, so that they can bring a voice to the table and not be token in bringing that voice. So right. It's complicated. It is.
Yeah, absolutely. Thank you for those reflections. Sharon, we'll just close out with your reflections on, you know, for leaders who want to work, you know, using these principles authentically, what would be your offering on that and your thoughts on that?
Yeah, thank you. Leaders, basically, the whole word and by definition have followers. So if we are very true to who we are, we get very good at role modelling what we need others to do. I think that's the best contribution we can actually start to make. I frequently get asked to go into communities, and you know, I get helicoptered into people's frustrations, and Susan referred to this, that there's a lot of talking, limited feedback, and sometimes people really do attack us from the start, saying, this is another talk fest, what are we doing? And because I love to see outcomes, I appreciate that. I understand their frustrations. And again, all of the things we've spoken about today in terms of clear expectations management, great communication, are things that I love to embody, so that ultimately when we've been in communities now, I've been serving some of the communities I've worked with for 8 years, wherever possible, can we build lasting partnerships and foundations which can then overcome some of those short-term challenges that Susan referred to, because it is budgets and cycles and requirements that create urgency, and sometimes we lose too much time in processing and we don't end up with enough time to be out doing the authentic who else and who aren't we speaking to that needs to happen, because those representative groups have formed. They're already very political. Usually there are then people who are totally disenfranchised with that. And again, sometimes they're the voices that we actually need at the table even more, because already those representative groups may no longer be reflecting who they are. And I could speak to an example on cane farming here, where because some cane farms are now so large and corporatised, the smaller farmers are experiencing really different challenges. And if we have one thing at heart, it's that people are the experts of their own lives. I don't for a minute think I can understand anyone else's experience of life. Like every day for us is a page in a book. Every main sort of course of life we go through becomes a chapter, and every story is unique. So as best as we can, getting as many different stories to the table is what I love to do. So find your mentor, get more skills, embody it, practice it, and just keep showing more people, because they will get behind you and follow too. And if you can train them, then they can start doing the same. And over time, we should get a lot better at making sure the people who participate get the feedback. Because I tell you what, nothing beats someone standing there next to you when you've created a dog fest, the thing they asked for, saying, "This is amazing, I can't believe you made it happen."
Great, thank you very much. Arthur, thank you for sending in that question, but we're probably running out of time to answer any more questions. What I would, but we will get back to you with a response to that, probably via email. Susan and Sharon, is there any final words you'd like to offer before we close out, just around co-design, participatory design? Any messages you'd like to give to our audience today, and then we'll close out the session.
I'm happy to start. Like, thanks for those that have joined. I can't see anything. I love co-design. It's one of my participatory design tools that I use to engage people right from the start and hold them right through processes over time to try and help contribute and make some of the change that they would love to see happen. So whether that's endorsed by governments at any level, funded by some other thing, but to then also figure out how else to create other structures to help support and keep that in community. So if you want to learn more, feel free, reach out. Great,
thanks Sharon. Susan.
Just also want to say thank you to everyone who's participated, and excellent questions. It's always wonderful to kind of hear what you're thinking as presented through your questions, and just encourage you as leaders to look for opportunities to create and hold spaces for people to have these conversations, share their understanding of things and work together to create things, that are meaningful for them. As Sharon mentioned just before, there is nothing more exhilarating than having worked with people who have a shared commitment to something in a shared place and see that come to fruition. It's really exciting work to do. So all the best with your futures and your work with the community.
Thanks, Susan. Everybody, I just want to thank you for your attendance today. Thank you for being here on the live feed, and for those who are going to listen to the recording, I hope you enjoyed as much as we have today. I just want to remind you that this is the second in a series of webinars that will be rolling out as part of the LARC program. Please go to the ARLF website and then onto the links for the Leading Australian Resilient Communities. It has all the details. The final 4 of our webinars will be in 2023. They'll include such topics as funding, whether that's government or philanthropy, a discussion around that, and also regional wellbeing. So I invite you to make sure you get to the website. I believe it's early February is our next webinar. But thank you very much. Sharon, thank you so much for being here today. Susan, the same to you. Thank you both for your time, your wisdom and your expertise. We really appreciate you having you as guests, and we wish you all the best with your future endeavours.
Thanks, Andrew.
Thank you very much.
Thank you.